So we're out in the country, and there is a house. I'm gonna draw a quick house with a roof. Okay, and in the house there is a cat, and that is the main pet. There we go. Eyes, and some gnarly teeth. Okay, there's the cat. Now, there's also some eyes, a smiley face, a rat. Now, this is a Tom and Jerry scenario, okay? The rat is always eluding the cat. The cat is super hungry and wants to eat the rat. And the rat is always messing things up in the kitchen, being a mess. So, one day, the rat runs away, runs into this tunnel cubby hole where the cat cannot reach. And the cat waits and waits, and the rat waits until the other kind of leaves. Well, all of a sudden, there's a roof, a bark. And so the rat is thinking, oh, there's the folks got a dog in there. Oh, that's nice. I don't have to worry about the cat no more. So he steps out of this hole and the cat starts eating the rat. But before the rat gets eaten, the rat screams out, "You tricked me!" And the cat says, well, in this economy, sometimes you have to learn a new language. So, the whole point of this talk is we're kind of learning a new language. We're learning a different way than the standard allopathic medical model way. So, with that, many of you have heard this, but I want to share Ellen's story with terrible migraines. That'll be right there. Migraines. So, Ellen used to have terrible migraines. She would have migraines more often than not. And she went to the medical doctor. The medical doctor said, "I'm sorry about your luck. You're going to have to deal with this for the rest of your life. Good luck." And I don't know if you guys know this, but she would have to inject this massive needle into her leg, which would instantly, she would pass out, right? So powerful narcotics that she was having to take. Anyway, chiropractic swoops in and changes our entire lives. And I'm going to get to that in a little bit. But some stats. Actually, first, I have some goals. I have a goal for this lecture, and I'm going to use a different color. Goal number one is I want you guys to be able to answer this question. Why would I get adjusted, or why would someone get adjusted when not in pain? Okay, that's goal number one. Goal number two is, simply put, interactive. Okay, so this lecture, this talk is for you guys. I already know all this stuff. So what I want out of this is participation. I'm literally asking, are you guys willing to have fun with me? Sweet! Okay.
Yes.
Now, let's do some erasing, because I have some stats for you guys.
Why are you erasing your beautiful cat and mouse?
I know. Okay, some stats. So let's put stats over here. Stats. So cancer, and this is in the US, kills 1,500 people per day. Heart disease in the US, heart disease is associated with 34% of all deaths. there it is. Okay, this might break your heart. Kids, 1/4 of them take drugs. So, and these are pharmaceutical drugs. So, dealing with ADHD, autism, these neurological disorders, or seizure medication, antidepressants, the list goes on and on. And then this, okay, medical errors. Yes, everybody makes mistakes. I understand that. But when I say medical errors, these are deaths, number of deaths per year due to medical intervention error. Okay? The number is 250,000 per year. There are studies that say that the number actually is that. How crazy is that?
So is that research coming from a medical perspective?
Medical research, yeah. Now, here's the thing. Let me change colors again. Okay? The US of A. Ooh, come on, marker. Okay, we are number 1. And that's not an arrogant statement. It is a fact. We have the best doctors, med schools, hospitals, and equipment or technology. Okay, we are number 1. Now, so when it comes to emergency care, crisis care, trauma care, we're awesome. But when it comes to overall health, how do you think we rank out of all the industrialized countries?
Probably pretty low.
The number actually is 79th out of 81 industrialized countries. We take the most drugs, we have the most doctors, but we are the sickest. Now here is where we get really exciting, really fun. Let me clean the board a little bit. Okay, so our narrative in the U.S. is you look good / you feel good. Okay, so here's the thing, and I'm going to use a darker color. I'm going back to blue. Okay, if you have symptoms, okay, you have pain, ailments, something's going on, then you are not healthy. You have poor health. Okay, sure, okay, that's going on. If that is true, then the opposite has to be true, right? Okay, you ain't got no symptoms equals healthy? Okay, do you guys agree with that statement? Because the person that has, let's say someone that was diagnosed with cancer, the day before they were diagnosed with cancer, were they this? They didn't feel anything, they didn't know the cancer was brewing. Are they healthy?
Like, for instance, like diabetes runs really bad in my family, especially for women.
Mhm.
And so they told me if I don't get my BMI in a certain range within 5 to 10 years, I would have diabetes. So right now, if I don't have any symptoms, you see what I'm saying? Like that
Yes.
doesn't necessarily mean I'm healthy though right now.
Mhm.
Because if in 5 to 10 years I'll get it if I stay the weight that I am. then I'm not healthy.
This is true. So let's dive into this, because this will make sense with what you were saying. Okay. Health equals function, okay? So let's do this. It's a scale. 0 here, 0% there. Let's go 100% here. Now, 0%, you're pushing up daisies, right? You're 6 feet under. 100%, now that is perfection. That is every single cell in your entire body is working optimal. There is no toxins, there is nothing. Okay, so we are all on this scale. Now, what the experts tell us, based off of the research, is that you have to lose upwards of 40%. So let me write that, 40%. 40% of function before you ever feel any symptoms. Yes, I spelled that right. Okay, now, what do we do with our symptoms?
Take a pain pill.
Yes, pain pill. What else do you do?
A lot of people will just grin and bear it.
Grin and bear. I like it. I like where you're going. Grin and bear. That's pretty much it, unless anything else. So pretty much how I have it written out is 1, you ignore. Ignore, which is find the cause, okay? That way you can literally head back to optimal health, optimal function, right? To answer how we do that, I have to bore you guys with some anatomy. Are you guys ready? Mm-hmm. Okay, let me do some erasing. This is gonna be good. Okay, perfect. Okay, let's use this color. What is the most important organ in the body?
Heart.
Okay, I got one for the heart.
Noggin. Can you say brain? A noggin.
The noggin. Okay, I have brain. Any others?
Spinal cord.
Spinal cord. Okay.
Your skin. I don't think it's. But I don't think it's number 1. But it's
Skin. I don't know how to draw skin, but skin.
It holds everything together.
So, I am going to blow your mind, literally, because your brain is number 1. But why? It is the most valuable player. It gets the most protection. Okay, your brain is fully engulfed in bone. Okay, your brain controls every aspect of our body, every cell, every tissue, every organ, everything. So that's number 1. There is a number 2. Your spinal cord, which one of you guys did say spinal cord. So you have all these bones that engulf the spinal cord. 24 movable bones. How neat is that? Now, they're movable. If it was just one chunk of bone like the skull, well,
we'd be protected, but we would walk around like broomsticks. And that wouldn't be any fun. Now, oh yes, okay, we're gonna get into some stuff now, okay? Get your thinking caps on. Your brain sends messages to the organs, right? Okay, it's through mental impulses. So let's write that down. Mental impulses. It's kind of like electricity. I'm going to use a fancy term, okay? Action potentials. What this represents, okay? You have a nerve, okay? Boop. And then it goes out to the next nerve. It receives, goes out to the next one, okay? Reason why I'm showing you this, there's ions in our cells. So there's negative ions, there's positive ions, okay? There's an exchange, one going in, one going out. So there's a polarity, okay? When that polarity changes, it sends signals downstream, down your arm, down your leg, things like that. So it's literally an electrical impulse. Does that make sense? There's electricity in your body. Okay? So that's action potential. So what if you have subluxation here and there's trying to be exchange and then it's like, oh, okay, we got it. I know my drawing is very fancy, but does that make sense? Okay, so let's get into it. I know that was a sciencey. Okay. Let's get rid of that. Let me complete this spine, okay? Okay, so say this is neck, so cervical spine. This is thoracic. Does anybody know how many cervical spine we have as I draw this?
7. Oh, I'm gonna guess 7.
Okay, we got 7. How many thoracic?
12.
How many lumbar?
5.
Okay. So let's use red. Okay, real quick. Nerves in the neck. They go to your shoulders, elbows, hands, and fingers and all that. Your nerves in your low back, they go to your hips, they go to your knees, they go to your foots or feet. Feet is a proper way of saying that. Okay, down your arms, down your legs. So, someone comes in here and they have carpal tunnel issues. Yeah, I'm gonna check the wrist, but where else am I gonna check? Their neck. If someone comes to you guys, say you guys are the chiropractors, and they're like, I have knee pain, where would you check?
Low back.
Their low back. Okay, now let's get really fun, okay? I'm gonna use purple. The neck. So, the neck goes to the eyes. Here's some eyelashes. The ears. That's an ear. The throat, eyes, nose, ears, nose. There. Yeah, I knew I was missing something. Nostrils. That's a nose. So, say someone gets misaligned in their spine. subluxated, well, they can have blurry vision, ringing in the ears, sinus issues, headaches like how Ellen had. You can have a lot of things, right? Now, thoracic spine, that is a lot of segments. I'm just going to go over a few, but that's going to your heart, your lungs, which that's lungs. Heart, lungs, you got your stomach in here. Okay, that's a food comes in, gets processed. You got kidneys, so let's draw a bean, kidney bean, okay? So you have a lot going on here. So subluxation there, you could have blood pressure issues, you could have breathing issues, you could have acid reflux, you have the start of kidney disease. Now, in your low back, you have things like the large and small intestine, okay? And your colon, okay? So that's a tube. So you could have ulcerative colitis, Crohn's disease, irritable bowel syndrome, constipation, diarrhea. It's just really a crappy situation down there. If you guys didn't get it, that's what I tried to draw. Okay. So, I've been using the term, you guys already know it, but let's write it out. Okay. Subluxation. Okay. That is what we look for. That is what we treat. But what is that? That's a misalignment in the spine, okay? That is nerve impingement. There we go. Okay. And I want to explain something. So we use the CLA technology, okay? And the main thing is that thermography. Do you guys know why we use the thermography?
Inflammation?
Yes, yes. What is inflamed?
Muscles?
Yes, yes, you are right, but more specifically, yes, you are also right. But with our technology, what we are looking at is nerve inflammation. The reason why it runs along the spine, and I'll show you guys. The heat detectors are running along here, where all these wires are coming out. Okay, so I'm looking for, is there a heat difference, because these nerves, when they're subluxated, get inflamed. They don't action potential quite how they should. Does that make sense?
So it'd be like a car overheating.
Yes, yes. Now, so I explained thermography, good. A lot of our folks have this. Let's go with arthritis. What is another term that I use? Spinal arthritis. Yes, yes. Okay, let me do a little erasing. Because what we're about to get into is going to tie a lot of dots together. And so, okay. So, let's go back to it. So, subluxation, misalignment of the spine, wear and tear, leads to a thing called degenerative disc disease. Reason why it's called a disease, by the way, is it's progressive in nature. Okay? And literally the disc is deteriorating. I know that's not real pleasant to say, but we have another way of saying it, spinal arthritis. Okay? So let's talk about the phases of degenerative disc disease. And I have a little model. So this is of the lumbar spine. Okay? You have a bone, you have a disc, you have a bone, right? Now check this out. See that spinal cord coming through the canal? And then it comes out and transmits these nerve roots that go to different places. You have 24 movable bones, so you have 24 segments of nerves coming out. So this is a healthy disc. Let's put that back. Let's go into phase 1. What you can see here is there is some disc bulging here. And if you kind of look at this lip, there is some bone spurring formation. But look at this. Look at that nerve. See how the normal nerve is? It's nice and small and tight. This is a swollen, inflamed nerve. This is exactly what you guys are testing when I have you guys do the thermography scans, right? So now, that's phase 1. Phase 2, which is honestly, that is the bulk of the people that we see in here. Because there are now tons of thinning at the disc, tons of bone spurring. Look, and after this lecture, you can run your finger across this and you can see the bone spurring isn't just on the front, like we see on the x-rays, it actually wraps around. It's Wolff's Law. The body is trying to compensate in its calcium deposits. And still, the nerve is inflamed. The communication action potential is not flowing. The mental impulses aren't communicating. And then we have our lovely phase 3. Tons of bone spurring, hardly any disc here. This is a really bad place to be. Now what they want to do, and when I say they, I'm talking about surgeons and medical doctors, orthopedic surgeons. Once you're in these stages of life, you have tons and tons of degenerative disc disease, they want to put rods, pins in your spine. Now that sounds like a great time, doesn't it? But let's talk about this, okay? And I don't know if you guys are basketball fans or not, but in basketball, you have 5 guys versus 5 guys or girls. You take one of the players out, now you got 4 versus 5. These 4 have to play like they're 5 guys or girls. They're going to wear out faster. They're going to deteriorate faster. What happens when you put rods and pins in one disc, you then make this one work harder and this one work harder. So in a few years, you'll have another surgery. This is what we want to avoid in folks.
When someone gets a shot, can you explain what that's actually doing to that joint?
So a shot, a cortisone shot. Okay. It's a ton of cortisone shot into a joint that causes de-inflammation. Sounds really nice. Really nice. However, it is a non-natural way of de-inflaming. The reason why a medical doctor will not allow you to have more than 3 per, I think it's 3 per 3 months, but I'll have to double check that. But however, because what it does is this shot deteriorates the joints, deteriorates the bones, which actually I'm glad you brought that up because I'm going to explain cortisol in our bodies a little bit more here in a minute. So does that make sense? The degenerative disc disease and the possible outcome of surgery not looking good. Okay. I painted a really bad picture. It's really negative. Okay, and actually, I got to paint it just a little bit more. Okay, because I want to explain subluxations one other way. Okay, so I have a friend, actually, no, he's really famous, and he's passed now, but you may have heard of him, Christopher Reeves. Okay, he was the famous Superman, probably the most famous Superman back in the day. He was the actor. Well, he went horseback riding, fell off his horse, landed on his head, and he dislocated the top bone in his neck. Okay? So what he did, let's change markers. Okay. You got a fuse box, okay? Let's do-do, 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 do-do. Okay, you got a fuse box in your house. It's probably in the basement of some sort. What he did is he turned off really the main breaker, okay? And if you turn off a fuse box going to your range, your stove, your fridge, what happens to these things? They don't work. The power source is totally shut off. It don't work. With Christopher Reeves, what happened is he needed, after this happened up until the day he died, had to use a ventilator to breathe. Someone had to massage his colon for him to have a bowel movement. Now the question is, did he fall on his lungs? Did he fall on his abdomen, destroying his intestines? No. What happened, and let me draw a picture because I'm hoping this makes sense. Brain, okay. Spinal cord. He dislocated that, right? When you dislocate that, you shut off the communication from your brain down. He was paralyzed from the neck down. Did you guys know this? No. It happened several years ago. But yeah, he was extremely famous years ago. Okay. Now, that is dislocation. What we want to talk about is subluxation. But it's a similar factor. The wires still communicate. So, with subluxation, it is a dimmer switch. Okay? Am I making sense, guys? Because with the dimmer switch, so say you're subluxated. No, you're not going to drop dead of a heart attack. No, you're not going to not ever have a bowel movement. No, your leg's not going to fall off your hip. You're still going to be able to walk. But it hurts. Those things don't work as well. Like your heart, we're talking, like say your heart for instance, it just doesn't function like it could have. Am I making sense? The power source is just tweaked down. It ain't severed. Okay.
But if it's left like that, will it could?
Yes. And I'm going to explain that here in a minute. Okay. Now I finished painting the bad picture. Now it's time for action steps. Who's ready for action steps? Woo! Okay. Let's use green. Spinal hygiene. There's probably an I here and an E there. Okay, spinal hygiene. There is 3 agreements that all anatomy and physiology textbooks agree on. And that would be one, the spine has to be in a certain alignment. Number two, has to be in full range of motion. You have to be able to move your spine, right? And then number three is the muscles surrounding your spine. So muscles surrounding the spine are strong and healthy. Okay, find that in any anatomy textbook, any physiology textbook, super cool. Okay, Doc, I want action steps. Okay, there are 4 simple exercises. Number 1 is wobble seat. Okay, you guys know this. You sit on this cushion and you wobble, right? You go forward, backwards, side, side. You have a lot of fun with this. You can kind of do a dance, do a little jig with this wobble seat. What is it doing? It is doing a thing called inhibition. And let me explain this. So let's go back to the disc. The disc, the cushion in between each of your vertebrae are avascular. Since we're talking about blood, let's use red. Avascular. Right? No blood supply. Okay? So here's the question. How do you get, because every cell, every organ in our body has to have nutrients, right? How in the world do you get nutrients in the disc and get the metabolic waste out? Pumping, aka movement. That's why they say sitting is the new cancer. Okay, gotta move. That's what we call inhibition, the pumping of fluid in and out of the disc. Now I'm gonna blow your minds for a second, okay? You sit on this wobble seat and it helps rehydrate your disc. What do you think I'm doing when I adjust someone here in their neck and here in their low back, those subluxations? I unlock the joint, allowing that joint throughout their day do that. These stuck joints are now unstuck. Now do you see why, with adjustments, our pre's and our post films, the discs look thicker? That's why the healing actually doesn't happen in the office. It happens out there. Okay, now number 2, exercise. Is morning range of motion. Okay, do you need to fix that? Okay, we're gonna have some fun. Stand up with me. So we're gonna practice our range of motion. So with our necks, we're gonna look down as far as you can. Look up as high as you can. Laterally bend to one side. Laterally bend to the other side. Come back to neutral. Rotate to one side.
Okay.
Rotate to the other side. Okay, so we just did the neck. Okay, let's do the low back. Same 6 cardinal movements. Flexion. Stretch that back out. Oh, that actually feels pretty good. Bend backwards, don't fall down. Okay, go to the side, laterally bend. Laterally bend. Fancy term for this is lateral flexion. Okay, come back to neutral and rotate. Now don't try to pop your own back. And then rotate. Okay, now let me write that out. You guys can have a seat. Thank you for having fun with me. So we have flexion, extension, you got lateral, flex, times 2, because you got 2 directions. You got rotation, times 2, because you got 2 directions. Why in the world do I want you guys doing range of motion exercises in the morning to start your day?
To help keep everything loose and moving.
Loose and moving, yes, absolutely. I like that because where your joints, your ligaments, your tendons get to a pattern. You're creatures of habit, right? So take a forklift driver. They're always looking back to the right, overhead, back and beep, beep, beep. Or, let's use myself for example. I prefer the right side of the table often, and I feel the spine, I'm like, ooh, dude. But can you see how my spine is twisted as I do that? Okay, so your joints, your ligaments get used to one thing. Another example, crossing your legs. You always cross it one certain way. If I said the 3 ladies that have their legs crossed, do it opposite. Does it feel weird? Because your body's used to that. Now you can go back to your normal. Okay. Number 3, TheraBand. Okay, and I have one. And I'm gonna look silly in front of you guys. No judgment. But I'm gonna take this TheraBand. I'm gonna put it behind my head and I'm gonna stand with good posture or sit with good posture, and I'm going to extend it out, okay? And then I'm gonna come back. So I'm gonna hold for a 2 count, and I'm gonna do about 5 to 10 reps. What am I doing? This is an isometric contraction. And when I say isometric, it's just the joint isn't moving. It's stationary, but there's tension in the system turning on these intrinsic muscles in the neck. Those intrinsic muscles of the neck helps your posture. Now, let's talk more about posture with number 4. Molding, spine molding. Since I have things on this table, I won't ask for a volunteer, but I will just explain it. But I do need one volunteer to come up here, please. So I have my model, and we have curves in the neck and curves in the low back. And actually, just so everyone can see, eyeball, nose, mouth. Okay, now what we have is the curve goes this way for the neck. That's a little exaggerated, but you can see thoracic, lumbar. Just so everybody is clear, this is the butt. Okay, this is the low back, mid back, neck. Does that make sense? Mm-hmm. Okay, so there are these major curves, low back and neck. So now with my model, turn and face that way. When you lay on your bed, okay, don't do this on the floor because you will hate me. You will lay on one of these right about here, and you also have a second one right here at the small of your back. This static hold will actually encourage your spine to mold, right? Molding into having healthier curves. Thank you. So these are the exercises. These are things you can do at home. This is how we together fight against a thing called DDD, degenerative disc disease. Now, okay, we have some action steps, but let's go even deeper, okay? Are you guys still with me? Okay, how in the world do we get subluxations? I am listening to you guys.
Correct.
Okay. I heard stress.
Sports.
Sports, okay.
Car accidents.
Ooh, that's a big one. Oh, we could have a long conversation on that one. Anything else?
Birth.
What was the last one?
Birth.
Birth? Well, that sounds just absurd. Okay. Let's dive into it because every one of you said some really good answers and I'm super proud. This is going to be super simple. 3 T's. Okay? Super easy to remember. Trauma, toxins, and thoughts. Okay, so with traumas, we got micro, we got macro. Okay, and some of you guys have already said some things, so I'm gonna just list them out. I heard auto accidents, I heard sports injuries, but what about the micro? Micro is more common to come in here than macro, even though auto accidents and sports injuries comes in. Fall on ice is still macro, but that's a super good example. I'll help you. When I say macro, something happens.
Is it like repetitive use, like sewing and stuff?
Yes. Yes. Okay. Let's go there. Sewing. Okay.
Sitting in a chair.
Sitting in. So can I say poor posture?
Yeah.
Okay. Poor posture. I'm gonna throw in like factory work, poor posture. You guys kind of get the idea. Something repeating over is making your joints and ligaments that get used to one direction. Hence, I'm going back to that range of motion exercise. Destroys your spine. Okay. Trauma makes sense. What about toxins? Food. Okay. So, are you saying that there are toxins in our food? Like chemicals? Oh my goodness. Okay. Any other toxins in our world?
Air.
Air. So air pollutants. Tints. Okay. How awesome is our cleaning supplies? If it's powerful enough to clean a stain that's been there for a year and a half, do you think it's good for our bodies? Okay, now I'm gonna make some bold statements. Okay, are you guys ready? Hopefully I don't offend you too much, maybe just a little bit. Drugs. Some people call them medicine. Antibiotics. Things that get injected into our system that is foreign, man-made. Okay. Would you guys like to know how to fight back against some toxins? Okay. One way is obviously our Edison pack. Our nutrients in our world today is not that of what it used to be back in the 50s or the 40s or the 60s. Okay, so good nutrients, there's men and women packs, right, that give us what we need, but there's also nerve, bone, joint support. But there's one other thing. Ty, grab the detox pack. Thank you. We also have a daily detox, okay? This is one of the biggest ways to fight against toxins. Why does toxins cause us to get subluxated? And that is because when you interfere with the gut flora, you then send signals back to your brain, causing things to sublux. Now let's talk about thoughts. Everybody, when I tell them about thoughts will subluxate you, they think I'm crazy. You might think I'm crazy, but I'm gonna go on a limb. Why do you think thoughts will subluxate you?
I was telling Ellen about that. When I get stressed, I go like this.
Probably not very good.
Okay, so you're saying when you're stressed, your posture is terrible.
Yeah.
Okay? 100% true. Right? But that's not it. Okay? With poor thoughts. So what we're talking about is really mental health. Okay? How you think about yourself, how you think about your job, how you think about your family, your situation, your church, your whatever, your relationships can drastically affect your body. How? Cortisol. And we mentioned cortisol shots. When you have overly high cortisol levels, stress hormone is what it is, stress hormone, those ligaments, those tendons, they break down. They're not as strong. Now, let's go further. Say you're in college, you're a college student, and you just finished finals, and now you're on Christmas break, okay? And you get sick during your Christmas break. Why did you get sick during your Christmas break?
Your body's not overworking itself during that.
Yes, it's overworking itself. Overly high cortisol levels. Your joints are inflamed and irritated. Joints, nerves, everything is inflamed. But also, your immune system declines. So let's write that down. Immune system decline. Okay? That's why you get sick. So, I'm going to use some examples, okay? So, traumas, okay? I mentioned Ellen with her migraines, right? Well, she was a phenomenal violinist. And I believe I spelled that correctly. But let's think about that. You take a violin, you hold it here, and you practice hours and hours and hours, right? Poor posture, right? Micro trauma. She didn't land on her head off the stage. She just practiced a lot to get as good as she got, okay? Toxins, so there's, obviously all of these, but let's pick on food for a second. So, Diet Coke. How they make Diet Coke sweet without having any sugar in it is a thing called aspartame. Let's see if I can spell it. Aspartame. Okay, that is a chemically made chemical, man-made chemical, thank you, okay, that is known as a neurotoxin. If you gave it to rats, they die. I know that sounds traumatic, but it is true. And then, thoughts. Well, by George, my wife is type A personality, get things done, so college was a wonderland of stress and anxiety. When you have the trifecta, does it make sense on why someone got subluxated and had migraines? Okay. Let's get to the question, okay? Why would someone get adjusted when they are not in pain or no longer have pain? I truly want to hear from you guys.
Positive thoughts?
Positive thoughts?
Yeah, like being adjusted and more positive thoughts.
Okay, so let's take some notes. Okay, so adjustments. You get positive thoughts. Okay.
You feel good.
You feel good.
My thing is like if something were to happen in the future, the ability for your body to recoup from something like that or handle something, probably a lot higher. Does that make sense?
Yes. So
Whether it's trauma or like stress.
I'm gonna put physical adaptability. Okay, physical adaptability.
Better posture.
Better posture. Posture benefits. Posture. Really good answers. I'm going to take it to the next level, if that's okay. Let's go back to brain, spinal cord. Okay, say you have some sort of subluxation in your mid-back, and that feeds in to the pancreas. I literally have no idea how to draw a pancreas, so I'm going to write pancreas. And hopefully I spelled that right. What does your pancreas do?
Insulin.
Yes, insulin. Okay, so in simple terms, it is the sugar metabolizer. That may not be spelled right, but that's okay. You know what I'm trying to say. So it is the sugar metabolizer. So let's go for an instance. You have a subluxation go into the pancreas. And I want to pause here because I want to back up because I want to explain one thing, okay? You have a mommy cell, you have a daddy cell, and they come together. Well, what do they start doing? They start to multiply, okay? All over the place. And then the notochord comes and all these cells and all these tissues form organs and tissues. Okay, so the cells multiply. Knowing that, now I can explain this. The cells in your body, well, they die, but you have new ones form. Okay, so for instance, the skin cells, they flake off, but you never have a big gaping hole because there's always new cells forming. Every cell in your body does this, even the pancreas. So, knowing that, there is a dimmer switch going to your pancreas and there's always new cells forming. Well, are those new cells, are they going to form right? No. Will those new cells produce insulin like it should? No. What if? Well, if this stays in here long enough, what is the diagnosis? Okay. What if we remove subluxation? Will those new cells start to form right? Yes. Will it produce the insulin? If we get to someone soon enough and remove their subluxations, do we have to worry about that? Adjustments may make you feel good, but more importantly, they make you live good. I want to make sure, I'm pausing real quick, I want to make sure you guys have lunch because that is super important. I am really excited about this, and I could either, we're talking as an adult. However, most of our subluxation development issues come from when we are born. And when we were talking about traumas, toxins, thoughts, I overheard someone say birth trauma, but I didn't dive into it because I wanted to talk about it now. So, there was a study with OBGYNs, okay? And these are not your brand new OBGYNs. These are seasoned vets. They have delivered babies galore, okay? They know what they're doing. But they wanted to find out how much force do they use to get that baby out of that birth canal. And mind you, a woman's uterus is chock full of muscle. That's why the contractions hurt so much, because there is muscles upon muscles. So, they pull pretty hard. In the study, the average OB weighed about 170 pounds. The year of the study, the average baby born was 7 pounds. Now, I do not have a baby model, but I'm going to talk to the mother in the room. What would you say if I took a baby and I held it by the head, you know, day 1, day 2 after they're born, and just hold it?
Great.
What would you do if I did that to one of your babies? I'm getting a look. Okay. Why would that be crazy? 7-pound baby, holding it by its head, that encompasses about 1 pound, so about 6 pounds directly on the spinal cord. In the study, they pulled between 70 to 90 pounds. Okay, Mama, that would be like taking one of your babies, holding him by its head, strapping a couple 45-pound plates on its ankles, and saying good luck. How crazy is that? Now, I want to share a little personal story with you guys. My beautiful wife, that no longer dealt with migraines, but now is pregnant, was about to deliver a baby. And she tried to have a baby normal, vaginal, regular style. However, Isaiah, our oldest, was 9 pounds, 9 ounces, and she's very small framed. That didn't work. The doctor looked at us and said, we're going to have to do it the other way. So here's what happens. And this is how I remember the story. So, they cart her off. This team of doctors and nurses, phew, go to the OR. Okay? And I have to wait around because I have to get these scrubs. This one size fits most. So anyway, we go into this room, and this is what I see. Tons of lights and tons of doctors and nurses scurrying around. And in the center of the room is my wife. And they have her pumped up full of so much narcotics and drugs and to not feel pain. Obviously, she's going to get a cesarean, and she's shaking. Okay? The anesthesiologist is here. The OB doctor is here. I am sitting here holding her hand. I remember this like it was yesterday. I watch the doctor cut my wife open and rip and twist Isaiah out. I saw the twisting. He shows Ellen, baby boy, see mama, gives it to a nurse. They go over here to this station here, and they do all the APGAR things. They weigh the baby, they check if he's breathing, has all his fingers and his toes, blah, blah, blah. Okay? He's living, he's breathing. According to them, he was healthy. When they were all done and baby boy was all cleaned up, we go into our own room, right? Where we are finally alone. I'm holding my baby boy for the first time. And I turn his head one way and he turns fine. I turn him the other way and he just screams. My son is subluxated. So I adjust him 20 minutes after being born. But I often wonder, what if I wasn't a chiropractor? What if I gave up in school? What if I didn't do this, right? What would his life be like now that he's 5? Would he be developed autism? ADHD? Would he have developed ear infections, chronic ear infections, like many of our kids that come in here that we have to resolve? There's a lot of questions that I ask myself. And how many kids are being born traumatized? So, a little bit more. Give me just a few more minutes. Let's go some more action steps for you guys. Because there are 3 things can drastically slow down your healing process. Okay? Okay. Number 1, putting off getting checked. And this goes for patients, but it also goes for you. You are my most valuable patients in this room because you are my team in saving the county. Okay? So, putting off the problem. Maybe it will go away. If you came in for headaches, but your big toe hurts, you need to tell me. So, AKA, tell me so I can take care of you. Don't be afraid. Number 2 is covering up the problem. AKA the American way. Covering up problem. Okay, covering up problem. So I'm going to use this example. You got 4 teenage boys. They want to go down to spring break, down to Florida, and all of a sudden this oil light comes on, right? And they are like, I ain't dealing with that. They could go to this exit and go to Jiffy Lube and get things fixed, but they go to Lowe's, they get some duct tape, and they take care of that light really good. You don't have to deal with that no more. That's the same thing with ibuprofen, Advil, Tylenol. See, joints that are locked up and not moving right, just like the oil in the car is going to cause the engine block to seize up, your joints are going to seize up, aka arthritis, because there's not movement. So covering up the problem. Number 3 is my favorite, missing appointments. Okay. This may be frustrating for the front desk, Lindsay. It may be frustrating. But why is it important? It's not so much for us, but for folks that come in. And I'm going to use an example. I absolutely love biscuits and gravy. That is the fastest way to my heart. So one day, I wanted to make biscuits and gravy. The internet said you need about 2 cups of milk and a 1/4 cup of flour. When I read this, I thought the internet was stupid. Remember, I'm a doctor. I know things, and that's dumb. Way too much milk, way too little flour. This is what I did. I cut it in half, so now we do 1 cup of milk and a 1/4, I doubled it, 2x'd it, okay? What I proceeded to make was unedible paste. I didn't follow the recipe. I didn't get the results that I wanted. This deals with people missing their appointments. It's a misstep. You're trying to make a couple steps forward, but then there's that 1 step back. And then they miss. Okay? It doesn't hurt us. We see plenty of people, right? We're doing fine as an office. But as them, as an individual, they are literally killing themselves by missing their appointments. Now, I have another story. Mrs. Brogue, and I'll tell this quickly. So Mrs. Brogue, she was a patient of mine back when I was in Anderson, okay? She was, let me ask you this. Have you ever dealt with grouchy old women?
Yeah, I work for Chris Kirby. That's all it is.
So this grouchy old woman was dragged in by her middle-aged daughters. This lady, Miss Brogue, was probably about 78, okay? So older lady. And she lost her husband. She was recently widowed. She is really depressed, but she handles her depression with anger. So we go into the consultation room. I ask her questions. How is she doing? What's going on? How can I help you? Blah, 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 blah. And she gives me these really short, jabby answers. But she signs up for care, probably because her daughters forced her. And that's okay. So she starts in, and a couple weeks in, she has to see the female doctor in the office, and what we find out is that she no longer has to, she can make it to the bathroom without peeing herself in the mornings. Before, she would just pee all over herself. 2 more weeks, and mind you, this whole time I'm adjusting, she just growls as she gets off the table, just mean, hateful, grumpy lady. So now we're 4 weeks in, and she says, Dr. Mosier, I am so glad you are my doctor. Who are you and where's Miss Brogue? Okay. Now we're at the end of her care. We're doing a re-exam, right? And I'm asking questions like, well, Miss Brogue, how's your energy? How's your sleep? All good, I'm fine. And your pain levels, all these common things. Well, then I ask her, hey, Miss Brogue, you know, I'm just going through the list. How's your bowel movements? She gets off the chair, she looks at me and says, oh, honey, when I first started here, when I would get out of a chair, and she used a different word than I'm going to use. She used an S word, but I'm going to use the word crap. I would crap myself. I don't do that no more. That is why I didn't go anywhere. That's why I became a hermit in my house. Now, here's the fun thing. Bowel movements and bladder is nowhere to be found on my consultation sheet because she never told me. Because she didn't think chiropractic could help with those things. Now, at 78 years old, with these issues, becoming a hermit and becoming more and more depressed, how long do you think she would live?
Another year maybe?
Maybe, yes. Okay. And I've mentioned to you guys before, but the Titanic, okay? The Titanic went down. The ocean water, the Atlantic Ocean waters was freezing cold, right? Over 1,500 people died due to the hypothermia that happened within minutes. The sad thing is, the lifeboats, trying to make a flag. Lifeboats were half full. The whole point of this lesson is for you guys to realize and know that chiropractic and we are the lifeboats. I know that sounds really arrogant, and I don't mean for it to, but based off of what you've learned today, now you can empower and pull someone in. I have one last story, and then I will let you go. And you may have heard it. You may have heard it in churches before. This old man, he goes on vacation with his family. And he's a grumpy old man. There's something about grumpy old people with me today. But grumpy old man, okay? He goes on vacation. He gets an argument with his family, and he just like, I'm sick of this. I'm going to go walk the beach, be left alone. And it's early in the morning, right? The sun is just barely coming up. And he's walking, and no one else is out except for this dadgum 12-year-old kid way out there, and he looks like he's just moving like a dancer. Just weird. And so he gets closer to this 12-year-old boy, and now he can see there's hundreds of starfish all over, right? And this kid, he is picking up these starfish and he's just flinging them, just throwing them out in the ocean. And this old man says, "Boy, what in the heck are you doing?" "Well, sir, the starfish, they got washed up with the tide, and well, the sun's about to come out, and with starfish, they're going to dehydrate and they're going to die. So I'm just throwing them back in the ocean." Real polite. "Boy, look, there are miles of starfish, right? You ain't going to make a difference. Just stop. Just why are you doing this?" And he politely listens. He's a well-behaved young man, and he bends down. He picks up another starfish and throws it in there. And he's like, "Well, sir, it made a difference for that one." So the point of this lecture is, I hope it made a difference for you, but more importantly, I hope it makes a difference in you to empower you to make a difference for someone else. Pull someone else into the lifeboat.